Fullerton, Fullerton District Office. Just want to give you guys a brief welcome before we go ahead and get started and go over some brief instructions. Currently, everybody is on mute and will stay on mute until we begin taking questions, from which we will go ahead and unmute you. The way we will be taking questions will be through the raise hand function on Zoom. For those of you joining us via iPhone or some sort of phone, on the participants list, if you click on the participants options or icon, there'll be an option for you to go ahead and raise your hand. Go ahead and click on that, and that will notify us that you have a question to ask the Congressman. If you are joining us via a laptop, on the bottom right-hand corner, there should be of the participants list as well. There should be a more function, and you can go ahead and click on that, and that will give you the option to raise your hand as well. We will be taking only one question per constituent. We just want to make sure that we allow some time for everybody to ask their question. And should you have any follow-up questions or need more clarification on anything, feel free to contact our office. And of course, now without further ado, I want to go ahead and bring up Congressman Cisneros.
Hello, everyone. How are we doing? Hey, I just want to thank you all for joining me here for our Cisneros in your city Hacienda Heights Town Hall. Over the next hour, I'll do my best to answer as many questions as I can get to. I'm here to talk about the coronavirus pandemic, the federal government's response, and answer your questions live. On my website, you'll find information, resources, frequently asked questions on the crisis. As more people continue to get on the town hall, I want to take a moment and talk about the work that my team and I have been doing for California's 39th district. We responded to over 1,000 calls and voicemails throughout this crisis from constituents who need help and support. If you haven't heard back from us, please be patient. We're going through all these messages we've received and prioritizing based on need, but we will get to you. I assure you of that. We brought back over $131 million in coronavirus aid to our cities, counties, health centers, students, universities, and colleges. Congress has passed 5 bipartisan coronavirus response bills aimed at supporting our families, our workers, healthcare workers, small businesses. The first one provided $8.3 billion in emergency supplemental funding to combat the epidemic, including funding for research and development, local and state health agencies, and small businesses. The second one was designed to expand sick leave policies, strengthen testing, and support small businesses. The third one, the CARES Act, provided economic relief aimed at supporting workers and small businesses affected by the coronavirus. The fourth one, included additional funding for hospitals, healthcare workers, testing, and small businesses. And last Friday, the House of Representatives passed our 5th bill, the HEROES Act, which would provide more economic relief for our cities and states, small businesses and workers, and more funding for testing. I know you all have a lot of questions, so let's go ahead and get started.
Okay, if you have a question, go ahead and click on the raise hand option, and that will prompt or notify us that you have a question. We currently have no raised hands, so we'll give you guys some more moments. Again, if you want to raise your hand via iPhone, it is on the under the participants icon. You can go ahead and click that, and then it will give you the option to raise your hand. And then if you are on your laptop, you can click on the bottom right more option, and that should give you the option to raise your hand. Okay, great. Looks like we have one question from Mr. Stephen Okimoto. Stephen, you are now unmuted.
Okay. Hi, Gil. Thank you for putting this together. My question was, well, I run a small chain of restaurants, like 3 different restaurants, and I was wondering if there's any plans for any specific relief for restaurants in particular. Like, we just got the PPP loan about a week and a half ago, finally. But the one thing for us is that the payroll forgiveness, I mean, that runs over a course of about 8 weeks, and we're still under lockdown conditions right now. So we're still only able to operate with kind of a minimal amount of staff. So for us, I mean, over the next 8 weeks, we're probably not going to be able to pay out most of that money. So it's more of a loan for us than it is, you know, like an actual grant or any sort of relief. You know, for companies that are doing really well right now, they also receive the loans and they're doing, you know, they're paying out full payroll. They can get almost the entire loan forgiven. But for us, it would just be a small portion. So, I mean, it for sure was helpful. I mean, and thank you for that. But I was wondering if there's anything in particular that's in the work for restaurants or businesses that are still closed.
Well, thank you for the question. And I will say this, one of the great things about the HEROES Act was that it took that 8-week period that you had to start paying out the loan. It made it all the way until the end of the year. So we've extended it up until until like the end of December. Now, like I said, this bill has only passed the House of Representatives right now. This is one of the things that we've been fighting for, because we've heard from not only restaurants like yourself, but also other small businesses that just aren't able to hire back up to their capacity because of the situation right now, with things still being closed. So the HEROES Act does extend that from the 8 weeks that it was originally put in the CARES Act, and expand, or I'm sorry, to not the CARES Act, but the earlier bills, but it extends it out all the way until the end of December, which should be good news. But look, we've been working with all our small businesses. We know restaurants have been, you know, hit very hard by this. And so we are working there to make sure this, and as we negotiate with the Senate, when they come up and they take up the bill and they pass their version of more stimulus packages, this is going to be one of the things that we continue to support and fight for, to make sure that our businesses have the relief and that it's actually within the time frame that's going to be, you know, beneficial to them.
Okay,
Great.
great. Let's go ahead and go with the next question. Our next question will be from Ms. Diane Ortiz. Diane, you are now unmuted.
All right, thank you. I work for Hacienda La Puente Unified School District here, and I was wondering if there's going to be any type of security for the staff and the students regarding the COVID, and if policy is going to change regarding having sick children be allowed to be sent to school anymore, you know, that type of thing. And what's to protect the employees, because right now there's a fever temperature that if they have it over 100, you can send them home, but that has to be 100. So, and there's other symptoms that children have to have. And we have a lot of kids that come from foster homes or group homes. And I was just wondering, because I'm sure a lot of the germs are coming from their homes and the kids are coming sick. So there's got to be a new policy, standard policy set up, I would assume, especially after this, that would help us stay safe.
Right. So one of the things that we know for sure is that schools are not going to look the way that they did, you know, prior to March 15th, when we went into lockdown. Things are going to be a lot different. You know, not only maintaining the welfare of our students is going to be important, but also maintaining the health and welfare of all the staff that works at the schools, which includes, you know, administrative staff. You know, my mom worked in the cafeteria at a middle school for years. You know, the custodial staff, our teachers, you know, everybody is going to need to make sure that they have that security and that safety when they go to school, to know that they can go to work and go to school and not have to worry about getting sick. So, you know, classrooms are not going to look the same way. We've been talking about how classroom size is going to become smaller. Students are going to be more spread out. We're going to need more teachers. We're going to need more school nurses, you know, at our schools. You know, right now, I think most school districts only have maybe 1 or 2 nurses per district, especially the smaller ones. We may need to start staffing nurses at schools. Taking temperatures is obviously going to be one of those things. I'm sure they will come up with other criteria that you have to meet in order to in order to to go to school, whether it's you're going there for work or whether you're going there to learn as a student, it's going to be, there is going to be new criteria that's going to have to be set up. So the CDC is putting guidelines together. The state will have the ultimate say as to when that happens. They'll provide the guidelines for schools, and then the school districts will have to follow those guidelines. But because of this, like I said, we're going to need smaller class sizes. We're going to need to hire more teachers. We're going to need to hire more staff. The CARES Act included $13.5 billion for our schools. The HEROES Act, which the House of Representatives passed last week, included an additional $90 billion for retaining teachers and other staff. Professional development, on trauma-informed care and to purchase educational technology. Other things that funding could be used for. But maintaining, and I say this with everything, right? And it's not just about our schools, but whether it's our restaurants and whatever your work environment is, our health and safety has got to be our #1 priority. And I know the governor is working to make sure that that is, and that's one of the reasons, schools are part of his 4-phase program, opening our schools up as part of phase 4, because there are so many number of students and people that have to be there in one space at the same time for the schools. And we want to make sure that everybody is healthy and safety before we open those back up.
Great. Before we go ahead and move on to the next question, I actually want to take a moment to acknowledge Hacienda Heights Improvement Association Board President Scott Martin, who's on the call joining us. So we just want to take a moment to acknowledge him and thank you for joining us, Scott. I see you also have a question as well, but someone's in line before you. So let me go ahead and click on, this is a question from Mr. Henry Pedregon. Henry, you're now unmuted. I'm sorry, looks like.
Henry, we can't hear you. Are you muted? Do you need to unmute yourself? We can't hear you, Henry. I need you to unmute yourself, or Erica, unmute him. There you go. Now you're unmuted.
There you go.
Okay, very good. Hi, Erica, Martin, and Congressman, thank you for the opportunity.
Mhm.
Just saw a thing on social media about a couple of weeks ago regarding HR 6666. I can't remember who the author was. I don't even know if it's in effect yet, but there was kind of a scare tactic that I guess the government could come into your home, knock on your door, and if you'd been exposed to the virus, they could come and remove you and your children as well to a undisclosed location for isolation. Is this true, or what do you know about this? And lastly, where can I get a haircut?
The haircut, hopefully salons and other places will start to open up soon. And I know the governor has started today in his press conference and talked about more businesses being able to open up as, the number of individuals going into the hospitals and the number of cases starts to decline. Haircuts are something that are very important and some people need to get. In regards to HR 6666, it's exactly what you just said. It was nothing more than a scare tactic in order to get people excited that somehow that this was going to happen and they were going to go into your home and just take you away as if somehow the rule of law is just going to go away. But that is not the case at all. This has just become another scare tactic by some individuals trying to really just kind of disrupt them and to kind of really they're putting this out. And we know this happens all the time, where there's groups out there that are going out there and just putting out their propaganda and just want to cause distractions. This bill does nothing of the sort. Part of the thing that is going to happen in regards to getting a handle on this is being able to trace the virus. And, you know, there are already, you know, they're already kind of able to trace it already, right, anonymously to look at information and how people are moving. You look at countries like South Korea, which has done a great job of containing the virus. They've been able to track people, where they're going, where their movements are, and inform other individuals what can happen. That's not going to happen here, you know, but we do need to be able to kind of track information anonymously. And there are actually, you know, that needs to be done in order to get some control over the virus, as well as the other thing that we need to start doing more of is testing. We need to be able to test people at will. When people need to get a test, they should be able to get a test. You've got to make sure that our frontline workers, whether it be those that are working in hospitals or those that are working in grocery stores or in, you know, out there in the fields or in meat packing plants, they need to make sure that they can get tested when they need to get tested. And so, you know, these are all things that we need to keep improving on and that needs to keep done. But yeah, that bill that keeps being mentioned, it's nothing but a scare tactic by some individuals just trying to get people excited. Nothing, you know, you still can't go into anybody's house and you can't take their kids away or anything like that. But just because you have a fever, or you might be kind of, you know, tested with the virus. So please disregard any of that. But that nothing could be further from the truth.
Okay, great. Let's go ahead and again, one more time, I want to thank Scott Martin again for joining us. Scott, you are now unmuted. The floor is yours for a second.
Thank you. Congressman, thank you for hosting this. Erica Martin, thank you for coordinating it. And Erica, thank you for recognizing the Hacienda Heights Improvement Association. Congressman, last week I was on a conference call with you and some other civic leaders and mayors, and on CARES and possibly CARES 2, I'd pose the question, and maybe you can share your insight as to how you think this may or may not work. With the money that will come down to states and to cities, with Hacienda Heights being an unincorporated area, then those monies are going to go to Los Angeles County. Are there any types of safeguards to make certain that the board of directors, the supervisors, I'm sorry, for Los Angeles County, making sure that those monies make it to the unincorporated areas? Thank you.
Well, you know, it's the supervisors, and the two supervisors that cover part of the 39th are both Janice Hahn and Hilda Solis. You know, if they want your support in the next election, whenever that comes up for them, you know, they need to make sure that they take care of both Hacienda Heights and Roland Heights, which are the two incorporated areas of the 39th Congressional District. One of the benefits, I guess, that they've had that other cities in the district didn't have was that, they were LA County, because it's part of LA County was able, in the CARES Act, was able to receive money directly, you know, directly from the CARES Act. And then they were able to distribute that money, you know, where they needed it, right, amongst the county. You know, the CARES Act put a population requirement of 500,000 people. So unless you had a population of 500,000 people, you know, you weren't going to get any funding. So really the only three areas that, well, actually only two areas in the 39th that actually got any money directly were Los Angeles County and Orange County. And so LA County, like you said, the supervisors need to make sure that they are taking that funding, that they're going to use it in those unincorporated areas. It would benefit them to do that. We will continue to work with them to make sure that they take care of Hacienda Heights. You know, we've had discussions with Janice Hahn and with Hilda Solis, and we will continue to make sure that we stay in touch with them and let them know your concerns. You know, what needs to be done. That's one of the reasons why we attend your meetings. Erica goes there to attend your meetings. That's one of the reasons we stay in contact with you, Scott, is so that we know what's going on in Hacienda Heights, and so that we can let the supervisors know, like, hey, this is what we're hearing, and this is what the people of Hacienda Heights need.
Our next question is from Adriana Quiñones. Adriana, you are now unmuted.
Thank you, Erica. Good afternoon, everyone. I'm glad everybody was able to join in. I have a question in reference to a national policy for going back to work. There's a lot of confusion about people that have pre-existing conditions and people that are older than 65. If you do have a national policy, will you be able to have funding so that there will be a program specifically for that?
Well, Adriana, thank you for the question. Unfortunately, one of the things that we have been lacking at the federal level from the Trump administration is really a national policy. He's pushed a lot of that responsibility off onto the states. He himself said he wasn't going to accept responsibility, but really our best case and what we need to look for really is coming from Governor Newsom, and really what that policy is going to be for the state. The CDC is putting out guidelines. That's where the social distancing has come from. That's where washing your hands for 20 seconds. That's where wearing the mask is also a CDC guideline right now. But it's really the governor of California is the one who's going to kind of set the policy and as he's done, right? He came out with certain benchmarks that the state was going to be able to have to make, and sort of we can even think about opening up. And then he came out with his 4 phases of really getting back to where we can open up. Those are the guidelines that are being set, and for, those are what we're going to have to follow, and what is really going to be our guideline as to how we kind of go. Each state is pretty much operating as its own independent entity right now, going by their own guidelines as to how they're going to open up and how soon they're going to do that.
Okay, our next question will be from screening CA. CA, you are now unmuted.
Was that CA?
Yes.
Oh, okay. Hi. My question is more focused on the unemployment. And my issue is that I'm a school employee. I'm a contract teacher.
Mm-hmm.
So obviously when our school shut down in March, I did not continue to get paid. So I filed unemployment, and the issue is that there's some information incorrect on my account. I've tried for 2 months to contact somebody, and obviously there's no going through, no one's answering, or if it does, it's a recording and they hang up on me. How can I get help speaking to somebody that will correct my account so that I can get the unemployment benefits?
So I'm going to assume the mistake was probably made at the school district you're working for, or you were working for?
What happened is last year when I filed,
Right.
I was qualified, and then because I had a letter of reassurance that I would be going back, then they disqualified me because they said, well, you have assurance of going back as a substitute teacher.
Right.
But this year I was not a substitute teacher. I was a reading specialist under contract. So they're still basing it on the 2019-2020 year. And so they're still considering me disqualified. Whereas the file when I filed in March, it's a whole new claim.
Right.
So they automatically disqualified me again.
Okay, so I'm gonna give you our office number. It's 714-459-4575. What school district?
Hacienda La Puente.
Okay, we will connect you with someone at Hacienda La Puente that will help fix that problem, and then we can help connect you with the EDD, as well, to kind of fix that for you as well.
Okay, I'm sorry, I didn't get it all. 714?
714-459.
Okay.
4575.
457. Okay. Well, thank you for that, because I've
Okay.
really been trying, like, before it's 8 o'clock in the evening. I've just tried so many things. So I figured, okay, now it's time to go to my congressman.
Right. No, we'll connect you with somebody over there that can fix that problem, and we'll also, can you, we can't do the EDD, but we can, put you in touch with the assembly person who covers you, and so
Okay.
that they can help you out.
Thank you. I appreciate that.
Okay.
Yes, thank you.
All right. Thank you.
Okay.
Okay, our next question will be from Diane Ortiz. You're now muted.
All right. My other question is regarding the state budget. I know he had put one out and he's due to have another one put out by June 1st.
Mm-hmm.
But with all the expansions of the classrooms and more staffing, I know a lot of money was targeted for special ed this budget. Do you know how that's going to, the money's going to have to get distributed more to the education if we're going to expand the classrooms? So
Right.
where are the cuts going to be?
So, well, hopefully there won't be any cuts, but we do know this right now. In California, we're facing a $54 billion budget gap because of the coronavirus. People aren't shopping like they used to, so we're not getting the sales tax revenue like we did in the past. Some people are paying their property taxes, and it's been a struggle. People have been out of work. They haven't been able to do that. So there's a lot of lost revenue for the state. So one of the things that I've been doing at the federal level is really fighting to make sure that we get funding for, all our municipalities, all our states. The HEROES Act that we just passed in the House of Representatives provides $875 billion to our state and local governments. $500 billion will go to the states. $375 billion will go to cities and counties. And so this is, this has been a crisis that the country is going through right now. And, I don't know if anybody watches 60 Minutes, but the chairman of the Federal Reserve said, right, the only way we're going to get through this is Congress is going to have to step up and really kind of help provide additional funding for our local municipalities and our states to ensure that they can make up these budget gaps that will allow them to go and provide the funding that's going to be needed, and to provide the additional funding that's going to be needed in order to redo our schools the way they're going to have to be done here in the future now. So this is something that I've been fighting for since the beginning. I will continue to be fighting that we make sure that we take care of our local municipalities, take care of our boards of education, because this is something they all provide services that we depend on, whether it's our police and fire or our schools. We need to make sure at the federal level we provide the resources so that we can keep these programs alive and running and take care of our public safety without having to cut anything.
Okay, I just want to take a moment to remind everybody, if you would like to ask a question to your Congress member, you would just have to select on the raise hand option that Zoom has. In order to do that from a smartphone, you would just click on the participants tab down on the bottom and select raise hand, should be the bottom right. And if you are utilizing a laptop to join us today, you will click on the more options, also on the bottom right. Click on that, and then a menu will go ahead and pop up for you to click on the raise hand options. Go ahead and do that, and we will take your question. Looks like we have one question. Martin, go ahead. You have a question?
Sure. So this one was submitted to us, and I'm going to go ahead and read it. We had one person submit in writing about the motel that is being used in Hacienda Heights as part of Project Room Key to house homeless individuals. People are afraid this program is just the beginning of leaving homeless people imported from other areas to our community, who will just stay after the pandemic the pandemic is over, who can make sure that who can we trust to make sure they're taken care of?
So the Project Room Key was a program, created, at the state level, and really the county's running it, to help get our homeless people off the street, because while they're on the street, they're really more susceptible to being infected by the virus, and not only being infected by it, but also spreading it around. And so Project Room Key was a program to get individuals off the street into some shelter that would allow them to stay safe. Now, everybody who's participating in this program right now, that's at the location there in Hacienda Heights, is not infected. They're being tested, and if anybody does end up testing positive, they are removed immediately and taken over to a shelter, another facility over in Pomona, where they are handling individuals who have been infected with the virus and tested positive. This program is not something that's going to last forever. The hotels are right now, they don't want to do this, forever. They want to be able to get back to their regular business as well. And so this is just a program that provides some flexibility to allow us to get people off the street who would really, if they were on the street, would just be, more susceptible to getting the virus and to passing it on to other individuals. But this puts them in a safe environment where they can be, make sure that they don't get it and they don't pass the virus along. And so far it's working very well. And with my talks with the Board of Supervisors, they are both supportive of this program, and they want to make sure that it continues as long as this pandemic is going on, right? But the HEROES Act has provided funding so that these programs could be run, so it's not a burden on the taxpayers. But this is something that we will. It needs to be done for health purposes. But I assure you, if anybody is sick, they're removed immediately. If they test positive or they're starting to show signs, they're removed immediately and taken over to another facility outside of Hacienda Heights. Because the other thing is they don't want to infect the other individuals that are there staying in Hacienda Heights. But this is a good program that's not putting anybody in danger. Like I said, nobody is there has the virus, so they're not spreading it around. It just puts them in shelter where they can stay safe. And really, it's not about bringing other people in there that are going to stay in the neighborhoods.
Okay, our next question, Scott, you're up for your question. You are now unmuted.
Thank you, Erica. Congressman, will there be through federal funding as a byproduct of this pandemic and 35 million out of jobs, do you see federal programs, like post-World War II, and they were building bridges and building trails and parks? You see something happening, and certainly that may affect our local area, maybe not necessarily Hacienda Heights, but trails and state parks?
I hope so. When I was running for Congress, and since I've been in Congress, I have been advocating for an infrastructure bill that's not only going to take care of our roads, transportation, but also would take care of our highways, take care of our rail. Here, I think in Southern California, we need to invest in public transportation. That's something that needs to happen. Other programs that we need to do right now, the one thing that we're finding out, and I shouldn't say finding out because we knew it was there, but it's really kind of becoming rising to the top, is really the lack of high-speed Wi-Fi for a lot of people in this country. Hasn't enabled them to go and to study. It's more that economic gap is creating more of an achievement gap. And that shouldn't be the case. And so they were talking about a national program where internet would be available, almost kind of become like a public utility, like electricity or water, that where people could get on there and be able to use a high-speed Wi-Fi. So there's a lot of projects that need to get done. We have bridges that are falling apart here throughout the country that need to be repaired or replaced. There's been talk before about a $2 trillion infrastructure bill to help take care of all this. I hope this is something that we can continue. The president has talked about wanting to do infrastructure. The House of Representatives has talked about wanting to do infrastructure. We just need to get the Senate on board so we can get this done.
Our next question is from Adriana Quiñones, once again. Adriana, you are now unmuted.
Thank you, Erica. Congressman Cisneros, I'm very familiar with Project Room Key. There was 2 conferences in reference to that, and there is a lot of opposition to that in our community of Hacienda Heights.
Right.
The reason being is because there was not a lot of community input before this program was implemented, but also because people are tired of putting a Band-Aid on this issue. I think we finally wanted to get it fixed where we get federal funding for permanent housing for the homeless. If you label the housing, not homeless, but maybe family support services, I think people would be more open to it. What do you think about that?
Well, yeah, I think, sometimes the way we call things, how we name them is really a turnoff to individuals. But, one thing that the CARES Act and the HEROES Act have done is help provide funding for projects, to give emergency solution grants, especially in the HEROES Act, that were local municipalities, local governments could work on this and provide that funding. The homeless problem here, is an issue that needs to be taken care of. It's something that we need to address, and it's something that we need to make sure that we don't keep passing the buck on, because people need support. And, there's not one solution for everybody because people are homeless for numerous reasons. And so I will say in the 39th, we've had some great efforts where there's been homeless, a lot of the cities here, and I want to say in the Orange County part of the district, have gotten together to create those navigation centers where people could go and stay, and it gives them a roof over their head. It allows them to get back on their feet, where they could get services that they normally wouldn't be able to get if they're out, homeless, living on the street. So, so hold on, Christopher. But these are things that, we need to make sure that we continue to provide funding for, that we continue to work on. It is something that you're right? It's an issue that we need to ensure that we provide guidance at the federal level, at the national level, to solve this problem. And so it's something that I've always advocated for, and it's something that I will continue to advocate for, to make sure that we continue to take care of this problem, because it's not going to go away unless we do something about it. And the one thing that we do know is that when we put somebody in shelter, it's a lot easier to take care of them and help them than it is trying to help them out on the streets.
Our next question is going to be from Sharon Ann. Sharon, you are now unmuted.
Hi, I had a question about when you look at the news, they tell you the state numbers of the coronavirus, deaths or sick, and the mayor also does it for the city. Do we have a resource that shows what it's like in Hacienda Heights? And because that has a lot to do with, should we open up, or how many places should open? Is there some place we can get those numbers? Thank you.
Yeah. The county public health department there in Los Angeles County puts out data every day on the number of cases and the number of deaths, throughout the county. This is information that we track every day. So it is out there. So far, Hacienda Heights has had like 86 reported cases. There's been 1 death. 266 people have tested positive for COVID-19. But this is something that it is. That you can go to the website, the County Public Health Department website, if you want to look up the information and see what it is. Like I said, they update it on a daily basis, and it really allows us to kind of track, to kind of find out what's going on and really where the hot spots are and where they need to crack down.
Our next question will be from, and excuse me if I mispronounce this, but screen name Eknakason. You're unmuted now.
Hi, thank you, Mr. Cisneros, for meeting with us. My question is regarding the Project Room Key shelter locations. And on Project Room Key, the website, it will list it as San Gabriel Valley, San Fernando Valley, and San Gabriel Valley currently has, I believe 4 shelters up, and it's listed as having a total of 8 to accommodate, and I believe the number was 1,500 homeless in the San Gabriel Valley. Each of those shelters can house about approximately 80, 85 people. And so we're short reaching that 1,500 number. And so in terms of locations, I'm interested in where the locations are. And then part 2, Hacienda Heights being in an unincorporated city, as well as Rowland Heights, are the unincorporated cities, because we really, unless we participate with Hacienda Heights Improvement Association, really can't voice or lack the information to have a voice. And so if there's a possibility of having another town hall where people can participate and be informed.
Yeah, you have your supervisors, right, who represent you. And, because you are incorporated, it's almost like they're like your council members, and because you don't have a city there. But, I would say never doubt that you can't go to one of your supervisor, Janice Hahn, to go and talk to her and let her know what it is that you want and that needs to be done. And if you need more information, that they should be providing that information to you, especially when it comes to where you live in the county that you live in. So I would, please don't think that you don't have a voice or that you can't go to their office to speak up. Because we've talked to their staff, and I know they would be receptive to hearing from you. As far as the locations go, that too is kind of run by the county, so I don't really have the information on that. We get briefed on where the locations are going to be, but as far as the number that they have and really how many people are actually in each location right now, I don't know that information offhand. But we could have somebody look into it, and we could pass it on to you if you like.
Okay, our next question will be from screen name Annalie McCallan. I'm sorry if I mispronounced that, but Annalie, you are now unmuted.
Yes, thank you for your time this afternoon. My question is related to colleges and universities that have announced virtual classes for fall semester. Do you have any information on what these colleges and universities are doing to prepare for the resumption of live classes versus virtual teaching, or if they are planning on continuing with virtual classes perhaps until there's a vaccine available? Do you have any information?
Well, I've talked to President Burgee over here, who the Cal State Fullerton is in the 39th, and we've also spoken with the the Mount SAC president, as well as the Fullerton College president, and Cal Poly Pomona, their president as well, as their plan. And they all are working on multiple plans. They all want to come back to be able to get to life school again. And, they understand too that, not only for our K through 12 is the classroom going to change, but it's also going to change for our community colleges, as well as our state schools and, our universities as well. They're all going to have to make different changes to make sure that the classrooms are safe, not only for the students, but also for everybody who is working at these facilities, whether they're teaching, their maintenance, or their administrative staff. And so, they all have a plan, right? I think what we heard recently on the news was that Cal State Fullerton has decided, or I'm sorry, not Cal State Fullerton, but all the Cal States have decided that, they're just going to go on next semester with the virtual classrooms. And really, that wasn't really a decision made by whether President Burgee or the president over there at Cal Poly Pomona. That was made by the chancellor, who runs the entire Cal State program. And I think that was just for the benefit of just to make sure that until they can make sure that they're able to rework their classrooms and do everything that they need to do, I think they just kind of saw this as the safest way to continue next semester, rather than just kind of trying to force it in there, right? Their priority, as I say, my priority is always making sure that everybody is safe and healthy and doing it the right way. And they don't want to put anybody at risk by opening up the schools again with not having what they would consider a safe program in place. So the Cal States are going to open up, well, I'm sorry, we don't know when they're going to open up. I know they are working on a plan to open up. I know all the colleges have multiple plans at hand as to how they're going to move forward, and they are making adjustments as they go, and they are really making adjustments to conduct their classes online as well, because that was something that was new to a lot of them, new to a lot of the faculty who had never had to do this before. And so, there are changes that are going to happen, but as they go forward, they will make sure that they put the safety and priority, their health and safety first, and make that the top priority before they go to a thing where they can go back to live classrooms again.
Thank you for that question. Our next question will be from Stephen Okimoto. You are now unmuted.
Hello again, Congressman. So my question was about unemployment insurance. I think in the last question I asked, you mentioned the HEROES Act, which passed through the House of Representatives. I think that act also extended the $600 federal additional compensation. So I have about 60 employees that work at the 3 restaurants that I run. And most of them have moved on to unemployment insurance at this point in time. And we're looking at reopening right now, or getting ready to reopen. I mean, we're starting to do some takeout and delivery and everything. And when we are allowed to, of course, we'll reopen. But a lot of my employees are concerned about how that would affect their unemployment. Like there's only a certain amount of money that they can earn before they would fall off of that. And so it's kind of a financial decision to them whether to even come back to work. I was wondering if there was any thoughts about, I guess, when that goes through the Senate and it's renegotiated, whether there would be any changes to that program and how it's administered. I mean, that money is extremely helpful for sure. Like my employees are very grateful for it. And, I'm grateful that my employees are taken care of. But at the same time, like they would like to come back to work, but, we would like to have it in a way that it works for everybody. So I was just wondering if there's any thoughts on how that might be restructured, or if it is in the works that could be restructured in a way where, there's an enticement to go back to work, but they're also taking care of it at the same time.
Right. I know this is, you're not the first individual that has kind of brought this up to me, that, a lot of, workers are making that financial decision that where because of the minimized hours that they might be working. You know, as you say, you're kind of bringing people back, but maybe they're not working the full 40 hours that they were able to work before. And, you know, especially if they're servers, you know, they're not getting the tips that they were before, which a lot of our, you know, our servers depend on that. So they're making that decision to kind of stay and to collect the unemployment because the $600 does provide them with, you know, resources, and it is beneficial to them financially to stay with that, even though they do want to go back to work. You know, our goal is to get everybody back to work. That was one of the reasons why we had the PPPP program, was so that people could, you know, businesses like yourself would be able to kind of continue to pay people to keep them on the payroll. You know, we want people to come back to work. You know, we don't, the unemployment insurance is not, we've expanded it during this crisis. That is not going to continue on forever. So hopefully, if anybody thinks that it will not. You know, as we move out of this crisis, those resources are going to kind of, you know, that's going to go away, and we're going to be expecting people to come back into the workforce. But we also know, you know, some jobs just aren't going to be there like they were before. And that this is why we spend a lot of money in retraining to put into education and the retraining workers as well. The workforce is going to be different than what it was before. Restaurants are going to be different than they were before. You know, we know you're not going to be able to be as crowded as they were. There's going to be less people eating in the restaurant. A lot of places that you used to be able to walk into, now you're probably going to have to make a reservation as restaurants start to open up. So, but we are, you know, we want people to get back to work. You know, the expanded unemployment insurance will not continue on forever. And so, you know, if people, I would say, have this opportunity where they can go back to work, they should look at that and really look to getting a job. Because one of the things, you know, that you're talking about, right, is that you have to have 100% of your employees back in order for the PPP to become a grant rather than a loan. But the workers need to understand is that doesn't, you don't have to have, you just have to have that number. So if you had, like you said, 60 workers working for you, you know, back to the date to when this program started, you don't have to have the same 60 workers. You just have to have 60 workers, hopefully, which will be extended beyond the end of December, that you have to hire back. So, you know, I hope people understand that, and if they have this opportunity to go back to work, that hopefully they will, so that they can have a job and have that security of a job after this pandemic ends.
Thank you, Stephen, for that question. We have time for one more question. Adriana, I'm going to go ahead and unmute you for your question, and then we'll have some time for some closing remarks. So, Adriana, you are now unmuted.
Thank you, Erica. Congressman Cisneros, when I lived in Los Angeles under Councilman Alatorre, something that he did that was very beneficial, very positive, is a town hall that had government, state, and local representatives with subject matter experts on different topics. It connected the community, it empowered the community. It was highly very positive to the communities. Is that something that you may consider doing in our community of Hacienda Heights?
Well, we've had numerous town halls, you know, throughout this. You know, we've been doing town halls ever since I got sworn into office. I made a commitment to do town halls. We were doing one a quarter during this pandemic. We've been doing several town halls. We've done a town hall with, you know, subject matter experts. We had people from the SBA and the SBDC, you know, on a town hall to talk to us, you know, about small businesses. You know, we did another thing where we had medical professionals from St. Jude Hospital talking to us about health issues as well. You know, we've been on calls with our mayors, with our city managers. We've been on calls with our school districts as well, you know, talking about different issues. So, you know, we always want to make sure that we put out good information. We've had, like I said, several town halls where we kind of talked about this, and we will continue to do other town halls where we engage, you know, engage individuals, whether it may be about a certain topic or not, but also make sure that we have, you know, those subject matter experts at all. Right now, you know, we made a commitment that I would go around and do an individual town hall just to kind of hear concerns from all our cities throughout the 39th, and that's what we're in the process of doing right now. But we will continue to do more town halls, and when we need to, we will have those subject matter experts on there like we have done already.
Thank you, Adriana, for that last question. Congressman, I'm going to kick it over to you for some closing remarks.
All right, so, you know, we're going to stop right there, but thank you all for being here. Thank you for your questions. Please, you know, if you, again, I gave out the number once already, but if you have any questions, please contact my office at 714-459-4575. We're here to answer your questions. Like I said, we've responded over to 1,000 emails and 1,000 phone calls. We will get back to you. I promise you that. We are prioritizing those that have an immediate issue and need something immediately done that we can help with, but we will get back to you, that I assure you. Excuse me, and I just want to thank you all for joining me here. You know, our Hacienda Heights town hall today. And really, before we close, there's just one last thing I kind of want to talk to you about, and that is the census. So if you haven't done it already, please tell your friends and everybody that they need to fill out the census. The census is, not only do we use this data to draw out our congressional districts, our state assembly districts, our state senate districts, but we use this data to really find out where we're going to put federal funding. Where are we going to put that new school? Where are we going to put that new fire station, or that new police department or police station? Where federal dollars are going to go, you know, is all based on the census data that we are going to be doing here this year. So if you haven't filled it out, please do it. I did mine already. It took me 10 minutes. You can get it done really quickly. And just so you know, it's against the law if anybody's worried about it. The census, they're not allowed to share your information with any other branches of the government. So, you know, I just want to assure you again that my office has been working around the clock, and we're here to address your concerns. And so please, if you have anything, please give us a call. We are there to serve you. And once again, I'll give you the number, 714-459-4575. But please, remember, I know I kind of mentioned earlier that the numbers are starting to go down, but remember, they're only going down because we're following the guidelines. Make sure that you keep practicing social distancing. Make sure that you're washing your hands. Please don't go anywhere unless you absolutely have to. We are all in this together, and we need to take responsibility not only for ourselves, but for others as well. Please wear a mask if you go outside. But thank you again for being here today and for giving me this opportunity to answer your questions. And so please take care of yourselves, stay healthy, and God bless. Thank you very much. Bye.